International Nurses Day, Health Minister Dr. Zweli Mkhize will hold a special candlelight ceremony at the King Edward Hospital in Durban today. This year, the focus will also be on the brave nurses treating COVID-19 patients. For more on this, we're joined via Skype by DENOSA's President Simon Hlungwani and NEHAWU's President Mzwandile Makwayiba. Gentlemen, thank you very much indeed for joining us, and a happy Nurses Day to you and your members.
Thank you very much.
Thank you very much. We appreciate the acknowledgement of the work that nurses do in South Africa. As nurses, we are happy to celebrate this day. Happy Nurses Day, President.
Simon, if I may start with you, I mean, we need our nurses healthy, you would agree. We need our nurses protected for their own good, for their families' well-being, and now more than ever, for our own good. Do they feel rather, protected currently?
Well, as you might know, because we are celebrating this day, it is the year of the nurse, it is the week of the nurse, it is the International Nurses Day. Nurses are anxious, they are human beings, and are not immune to any disease, including the COVID-19. This is why we have more than 500 healthcare workers who have turned positive with COVID-19. This is why among those, more than 200 are nurses. And among those nurses, 2 have already died. Our families are not immune to the disease. Hence, we are also anxious, worried whether who is next. It's a problem that we are facing on a daily basis. Nurses are anxious. However, there's one thing we can promise you. We will do our best based on our profession, our science, our ability, and the skills and knowledge that we have. We also need to be supported by our employers, be it government or private sector, by the provision of the PPEs that are necessary. And we need to be supported psychosocially because we are human beings, we get stressed, and to see this thing, you don't know whether you are next to turn positive or not. We need the psychological support that is necessary, including the transportation to and from work, but also anything that can be done to appreciate us. But today is about thanking every nurse that is there in the cold face, that is there fighting this pandemic. And we have seen a number of recoveries. It is due to the hard work that nurses and other health workers are doing in the hospitals and clinics. It is very much appreciated.
Mzwandile, what are your members telling you? Do they feel protected during this time of COVID-19? Very uncertain times. We're learning more and more about this disease as we go day by day. Still many unknowns. What are your members telling you?
Our members does not necessarily feel protected. Our members are of the view that private sector and government, they have tendency of looking to the profit, and at the same time looking from government side, looking to the side of servicing without necessarily taking seriously the care of protection of our members. In many times for our members to get protected and be safe at the workplace, despite the challenges we have to fight. It is now worse in the time of COVID-19 that we have to have struggles. We have to set the code for government and private sector to listen to us when we call to government and private sector to protect our members, to give our members protective clothing. We have to set in code for government to set up health and safety committees that are supposed to be there for, in terms of the law, for very, very long time. Only at this time that we are listening at things that should have been done long time ago. In my view, we should not have nursing dying for performing work, because we should make sure that protection is a priority. But that is not a feeling of our members, not a feeling of the organization that I represent. It's not a feeling of us that we are protected and we are priority.
Gentlemen, I want to play you a clip. Yesterday, we had a report from the Zweli Clinic in the Eastern Cape, and where nurses were concerned about...
I lost you.
we'll try to fix that, Mzwandile. Stand by. I just want to play your clip. Hopefully you can hear this clip of a nurse, or well, nurses yesterday. They were protesting outside the Zweli clinic in Port Elizabeth, and complaining about certain issues in terms of not being protected in many ways. Let's play this clip and have a listen to one of the nurses.
By this weekend, we've received that we have a number of about 11 staff members who have tested positive. As I am speaking right now, the manager of the clinic has just confirmed that the number has gone up, but she has not given the exact number yet, but it has gone up from the 11.
Simon, the Minister of Health has previously stated that healthcare workers are not expected to work if they don't have proper PPEs. What sort of reports are you getting from your members with regards to people forcing them, management forcing them in various parts, in various hospitals around the country to work without proper PPEs? Is this a major concern?
Yes, it is a major concern, and I can confirm that the Eastern Cape seems to be notorious in not providing PPEs, and some say no. They say we are going to run out and therefore don't utilize PPEs. We re-emphasize the message clearly because the minister said no one should be expected to work without PPE. So our employer promised to provide PPE. Any nurse who is not provided with PPE should not risk their lives by committing suicide of touching patients. So if no PPE, there should be no touching of patients. We rather fight until we get PPE because Eastern Cape was notorious in one of the hospitals when nurses and every other health worker there started saying we're not going to work until you provide us. Suddenly, when the MEC and the ministers ran there, the PPE was made available and it was delivered. So it means there could be PPE somewhere, but it is just not given to members in those areas. And the same problems are not necessarily happening in other provinces, but there are those provinces that are trying their best, but in some areas, like in rural areas, there is real great shortage where members are restricted in terms of the numbers of the quantity that they can get at a given point. It is a huge problem, but we still say our standpoint is simple and it's a serious resolve. If no PPE, there should be no touching of patients because that will be equal to committing suicide. You will get infected. When you live there, you are going to infect your own family. You are going to infect anyone you will be in a public transport, including your colleagues. And everybody will be wiped out if we do not have PPE. So that is it's a non-discussion because we have been promised that the PPE will be provided.
Simon, just stand by, Mzwandile. I want to play you another clip of a nurse complaining with regards to PPEs. Let's play this clip.
We are expected to wear surgical masks for 2 days. We are expected to wear N95s for 2 weeks. On the box outside the N95, it says that wear it once, but the employer is saying that we must wait two weeks. That is what we are fighting for. And now we've been talking in meetings. Seemingly, the employer doesn't apply whatever we agreed on. So now we are saying that we are shutting down this clinic.
Mzwandile, N95 masks, surgical masks, so important for healthcare professionals, healthcare workers. That's why we as the public are being told to use cloth masks instead of those N95 masks, it's much needed on the front lines by healthcare workers. Talk to us. We had seen a lot of reports about donations being given with regards to these PPEs. Is it filtering down to the various hospitals from the information you're getting?
Look, we talk to ministers at the level where we are. We talk to MSCs at the level where we are. But talk is not equally to the implementation. Our experience that everything said is accepted. Like my comrade Simon says that the minister says no one should go and touch a patient without protective clothes. But life there at the workplace is different. When nurses stand up for their rights, they are being put into difficult life. So it is the experience that what the workers, the nurses saying there, that we have experienced at the level of the institution, that when we want to have this, we don't know where they've been hiding, where they've been kept. We can't understand. Of course, the problem is that what the ministers and MSs are saying is not the same thing that is being done at the level of the workplace. Of course, at the center of this is profit. At the center of this is budget. At the center of this is exposing workers into danger. At the center of this is the absence of the health and safety committees that are supposed to monitor this thing so that they make sure that it's done. Is a failure of the government to put up those committees. Is a failure of the private sector to put up those committees, because the focus is not safety of our members, it's not safety of nurses, it is profit, or is to get service without necessarily provide protective clothing.
The world, Simon, we're told, needs about 9 million more nurses and midwives if it is to achieve universal health coverage by 2030. What are some of the risks associated with a shortage of nurses in a country like South Africa?
Well, the risks become the same as what is currently happening with the risk of not having PPEs, where the situation becomes catastrophic. I can tell you that we have had a meeting with our Chinese counterparts, and they told us the only way they could flatten the curve was because they were provided with PPEs. Now, if we get to what the World Health Organization has released as the State of World Nursing Report this year in April, they said it clear. For South Africa and any other country in the world to achieve Sustainable Development Goal number 3, we must produce or train the nurses at a rate of 8% on annual basis at a minimum. In South Africa, I can tell you that our rate has always been below 1%. Now, it's a challenge because it means come the stage where the population will be grown so much and there will be inadequate health professionals, particularly nurses, who will be able to take care of the population, which is going to be a serious issue. And some of us will be old aged at that time, and it is not going to be nice and easy when we are going to queue and looking to be assisted. We see the queues even at the moment, but if we do not pull up the socks and improve, it means the situation is going to be even dire. That's why we make a call to say we must, as we urge our government to commit into ensuring that there is training of at least a minimum and the full implementation of the report that was released by the World Health Organization, which is the State of World Nursing Report. And we can advise them and assist them in terms of how to strategize and plan, because we are willing to engage. And we must just increase internal capacity in the country to be able to train those numbers that we need. Otherwise, our nation will be doomed, and we don't wish our future to be doomed in that way.
Gentlemen, thank you very much indeed for staying with us. Mzwandile, if I may start with you this time. I mean, nursing as a profession can offer a meaningful career, you would agree. But from your knowledge, are young people's interest in nursing, in the nursing profession, high enough to ensure that the sector actually flourishes?
Well, there could have been very interesting young people in nursing. The problem are the difficulties that are experienced by nurses that are there. You just mentioned the report from World Health Organization. The government of South Africa and the minister knows, and they have this, and they know what's supposed to be done. We had a several meeting, we have a lot of discussion. They know all of this. The budget that is gone to Department of Health and the money that is spent on litigation as a result of things that are happening in the world because of the shortage of nurses, it's better for government to have enough nurses in order to save a lot of money. But for reasons that we don't know, this doesn't happen. Amongst other reasons that previously the previous minister has pointed out, is a inequality of funding of health system in South Africa. A lot of money goes to private health, and the less money goes to public service. If you look in terms of the scale, you realize that private sector only service up to 16%, and a lot more than 85% of the service goes to public service. But yet, we do not necessarily get what we're supposed to get. And one of the biggest shortages in the Department of Health is nursing. Therefore, it could attract young people, and we should go out and motivate for young people to take this profession, because it's a very, very important profession. But unfortunately, the way in which nurses have been treated, I don't talk about long hours they work. I don't talk about struggling and stress that they experience. Even when there was no COVID-19, in the normal situation, nurses are struggling.
You know, on one hand, Simon, you want to get enough young people into the system. You want to get them into this very critical profession. But on the other hand, with regards to nurses going abroad, seeking employment overseas, at what rate are we losing quality nurses, Simon?
Well, let me start by indicating that there is a lot of young, vibrant people and South Africans who are willing to get into the profession of nursing. I can give you an example. In Gauteng, there was some point where they advertised for these opportunities to train through government colleges for an intake of around, they wanted to take around 900 or so, but the applications that they received were close to 30,000. That tells you that the youth and the young people of South Africa would like to be nurses. It's just that the opportunities provided for, imagine 30,000, but you only take 1,000 or 900 of those, which then means that the whole lot are not able to get them. But I can tell you that with regard to the nurses wanting to go overseas, they were going out there for better conditions that included better salaries, other conditions of services, such as when you are in South Africa, it is known that we're having a huge shortage of nurses. So one nurse does more work for even other nurses that don't exist in that space, including the issues of not having support staff and many other challenges that we have in South Africa. So that's why people were leaving. But I can tell you that the feedback we are getting now that there's the COVID-19, some nurses who are abroad, they are saying they wish to come back and service their own people. Is that at the current moment, there's no way they can come back and service us, but they are feeling for their own people, their own families, that they could be contributing to their lives and saving the lives of their own people at the current moment. But if conditions are improved, if investment is increased in the health sector, it means those people can still come back and work. Improvement of conditions will then attract them back.
Mzwandile, as we wrap things up, I mean, a nurse's job is to give optimal care and help guide the patient to recovery. They play such a critical role in the healthcare system, and they are obviously, at this time, on the front lines in the fight against this pandemic. What's your message to them on International Nurses Day?
On the important day of nurses, the International Nurses Day, NEHAWU wants to tell nurses that first and foremost, you must be prepared to fight for your right. You must make sure that you don't allow anyone to do and send you into danger without a protective clothes. Continue fighting. Don't stop saving life. Make sure that we save our community. After all, these are our people that we're saving. Yet, we must make sure that we fight for our better paid and our better salary, and we must use this day to send the message to the public that yes, we are nurses, but we are also part of the community. Yes, we are nurses, but we are also struggling like any other worker. Yes, we are nurses, but we are workers after all, and we need to be paid. We need to be protected. So For this to happen, we must organize, we must fight, we must stand up.
Gentlemen, thank you very much indeed for coming on the program this morning and giving us a perspective of what nurses are going through on the ground. They are indeed on the front lines of the fight against COVID-19. We need them now more than ever, and we wish them a happy Nurses' Day. DENOSA's President Simon Hlungwani, as well as NEHAWU President Mzwandile Makwayiba. Thank you very much indeed. Quick break, more news next.